You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Building Sustainable Healthcare Homes is a new podcast series showcasing AAPCHO's Cultivating Traditions of Wellness 2010 Conference and Gala on February 23, 2010 in Washington, D.C.
In this episode, U.S. Surgeon General Dr. Regina Benjamin greets Gala attendees and provides leadership advice for advocates working in underserved communities.
I am really honored to be here. While my title is Surgeon General, my uniform really says that I'm an admiral, and with these little stripes, and I got some bars under my shoulders here. But that's because I lead the United States Public Health Service, which originated as a service to provide health care to merchant marines. But with that nautical theme in mind, I thought I'd share a story with you, which some of you may have heard before, but if you've heard it, you'll hear it again. Basically, it was a young ensign was on a battleship, and he had duty and had the watch one night. And he was looking out over the watch, and he saw a light in the distance, and he realized it was in the direct path of this great battleship. So he flashed out a warning. You are in direct path of a great battleship. Alter your course. He waited for a reply. The reply came back, no, you alter your course. So he went and got his captain. The captain assessed the situation, plotted out the course, and came up with the same conclusion. So the captain flashed out a warning. You are in direct path of a great battleship. Alter your course. They waited for a reply. Reply came back, no, you alter your course. So by this time it was getting pretty late, and they had to wake up the admiral. Well, the admiral, like any good CEO, says if you really want something done right, you do it yourself. So he plotted out the course, came up with the same conclusion, and he flashed out a warning. You are in direct path of a great battleship. Alter your course immediately. I am an admiral. They waited for a reply. No reply. They waited, still no reply. Finally, the reply came back. No, you alter your course. I am a lighthouse. You and I have to be lighthouses to stand our ground against those things and changing those things that we know in those battleships we know are moving in the wrong direction. Things like health disparities, the uninsured, the underinsured, the underfunding of Medicaid and care for the poor. You and I can change battleships just by standing our ground. Just like AAPCHO is doing, they're certainly trying to stand their ground by the advocacy they're doing here and slowly moving those big battleships into the right direction. It's slow, but it happens. And being a part of organizations like this will help make things happen a lot faster than if you could do them by yourself.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.aapcho.org and tune in for our next podcast at www.aapcho.org.